There are actually 6 forms of bruxism, which is the technical term for people that grind their teeth. Very frequently, the person who's grinding their teeth, even severely, has no awareness of it. And it's not unusual for me to look in somebody's mouth and see the teeth worn down 30 to 50%. And I'll say, wow, you really grind your teeth? And they'll say, no, I don't grind my teeth. It's like the person that snores, doesn't know they snore. To prevent further loss of tooth structure, we can always make a bite appliance that the patient wears at nighttime. That's called a night guard. And it is very effective because even if a person has had a stressful day or week, which correlates with how much a person grinds at night, the worst case, they might wear away a little bit of plastic, and it's much easier to replace plastic than it is tooth structure. So it acts to protect all of the teeth, and most people are more comfortable wearing one of those because it allows the jaw muscles to relax. It's like waking up each morning with the blackboard has been cleaned, as opposed to if you've been grinding all night, patients tend to wake up with stressed, tired muscles, frequently headaches that are correlated with grinding their teeth. And a lot of people that are treated for headaches medically are grinding their teeth, which is causing the spasm in the neck muscles and head muscles. And if they're protected from the bruxism or grinding, many times will diminish or eliminate the headaches.